Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate can be sure of happy heart. Today we have Dr. Sumit Kumar Majumdar, MD physician, Tomluk Medical College from Kolkata. Can high blood pressure be completely cured?
See, BP, there is a normal range, like if it overshoots 140/90, generally term it as hypertension. Okay, and there are several stages of hypertension, like stage 1, stage 2, stage 3. And to make this matter simple, we generally consider 140/90, greater than 140/90 as hypertension. Suppose if there is someone has 200 by say 110. So generally those severe hypertension generally has a secondary cause. Secondary cause as is like CKD or chronic kidney disease or aortic stenosis or pheochromocytoma. So generally if the secondary cause for the hypertension is correctable, like CKD, it's not correctable. So a patient with CKD who has hypertension will require treatment for hypertension for the rest of his life. But if the cause for hypertension is reversible, like if there is a pheochromocytoma, so where you can correct that cause, in such cases BP may be corrected, means may be cured, and patient may not require lifelong treatment. And in most of the cases, the BP, as we see, is like in essential hypertension, which generally doesn't have any obvious cause. In such cases, since there is no cause for the hypertension, the patient will probably require a lifelong treatment for his BP.
What is the relevance of heart rate in hypertension?
If someone has a raised heart rate with hypertension, it is more detrimental rather than having someone who has a normal heart rate with hypertension, because if someone has normal heart rate with hypertension, our case is simple. We need to correct the BP by giving some antihypertensive or lifestyle modification. But if the heart rate is raised along with hypertension, we need to investigate the cause for raised heart rate. We can order ECG, or we can look for some ECG will reveal if there is any arrhythmia, means tachyarrhythmia, and then we also need to correct the underlying cause for raised heart rate.
What precautions should a patient take along with medications?
What we always ask to the patient that there are two management of hypertension. One is pharmacotherapy and one is non-pharmacotherapy. So under non-pharmacotherapy, there comes diet, exercise, lifestyle. We primarily know that sodium is a key element which can increase our hypertension. So we always recommend our patient to limit salt in diet. Along with this, we ask the patient to increase the potassium in diet, because potassium helps to lower the BP. So anything that is rich in potassium like bananas, lemons, all this can help to lower the BP. Apart from diet, you must also ask the patient to lower the fat content, red meat intake in diet, which also will increase the peripheral resistance and increase his BP. Along with this, we have to ask the patient to have a sound sleep of around 7 to 8 hours and reduce his stress level. Stress level in his work field or any other cause, we need to correct, because some patient may also need help from psychiatrist to reduce the stress, his or her stress. And along with this, we need to ask the patient to at least have aerobic exercise. Aerobic exercise will also assist in reducing our BP. And also, aerobic exercise will help to reduce the stress, which in turn will help to reduce his BP. So more or less, non-pharmacological therapy for BP is, as I said, all this.
Thank you, doctor, for your time.